for years it's been common practice both in the States and also in Europe for women to visit their gynecologist once a year. In particularly for women under 30, it's important to have a well-woman check to discuss the need for sexually transmitted diseases, which we all know that they are common at about that age, between 20 to 30. It's also important to discuss the need for cervical smears from 25 years onward and to discuss various methods of contraception. After 30 years of age, it's important to have a well-woman check to make sure that there are no fibroids developing in the uterus, and also to check ovarian reserve, which tends to decline gradually from the age of 30 down to 40. After the age of 40, ovarian cancer can become an issue, as well as premenopausal issues in the late 40s. So it's important to have an ovarian screen, which involves transvaginal scan and a blood test called CA125. After the age of 50, uterine and ovarian cancer and the menopausal issue becomes a problem as well to check for regularly. So having a yearly scan will detect ovarian cancer and uterine cancer early. Premenopausal symptoms and hot flushes and night sweats are common together with period irregularities towards the end of the 40s, and having a checkup with the doctor might be able to give the chance to discuss sexual problems and menopausal issues, as well as hormone replacement therapy. Now, after the age of 50, uterine cancer can become an issue, and having a regular scan might allow us to predict and detect these cancers earlier than usual. During a well-woman check, we will take history, a detailed history from every patient. We will also do a full examination, which includes blood pressure, weight, breast examination, as well as pelvic examination. And then we will follow by transvaginal scan, which allows us to study the uterus in detail, as well as the ovaries. We will then be able to give women a full report immediately after the consultation, and the blood tests or smears or any other swab tests usually are available within few days. As part of well-woman check, we also do blood tests and blood pressure checks for lipid cholesterol profile, or for cholesterol profile rather, in order to estimate the risk of heart disease, and we assess the lifestyle of women and advise exercises in order to improve and reduce the possibility of heart disease later in life. Nowadays, women tend to delay pregnancy later after the age of 30 because of career opportunities and going to universities. We offer fertility check to check ovarian reserve and advise women who have decreased ovarian reserve to have pregnancy earlier than later.